Now in this case, you may still be exceeding the torque, but one of the nice parts of using the manual torque wrench is you could place the implant to the crest of the bone, reverse the manual hand wrench, and actually back the implant out 3 or 4 millimeters. This creates a path for the implant to be seated in. You would go back to the in position. And finish placing the implant to the crest of the bone. Now when I remove this manual torque wrench, I want to show everyone that we have good angulation for this dental implant. It's not too much to the buccal, lingual, mesial, or distal. It's straight up and down. The implant's in a good place for restoring. At this point, we would remove the torque wrench. Now something has to cover the top of the implant. Our options are a cover screw or a healing abutment. In this case, we're going to use a healing abutment that allows the gum tissue to form around it. Once again, one nice feature is they say that everything is friction fit, but when working in a patient's mouth, it's important to be careful. So while this screw does not fall off like this, I always make sure I use a gauze pack around the patient's tongue or over the roof of the mouth so nothing falls out, and if it does, that would catch it. The healing abutment is introduced into the implant. The top of the screwdriver is stabilized. And in this case, this is a rather large healing abutment. The examples that we have here, in working in a patient's mouth, you would use probably a 2 millimeter healing abutment, something shorter that wouldn't be above the level of the adjacent tooth. But that's just for this exercise to show you that a healing abutment would go back on top of it. I'd like to also show you with the healing abutment removed, this dental implant is about 2 millimeters away from tooth number 5, the distal number 5. That's an ideal position. It'd be ideal for restoring the case. You don't want the implant too far to the distal. You create a mesial cantilever and too large of a crown. And you also don't want the implant too close to the other tooth, because when you infringe on that tooth, you could cause an endodontic problem or a problem with the root of that tooth. So that's basically how you place a dental implant, simple and straightforward, just much like placing a post and core. And I think that's a skill that all general dentists could do, and we'd be happy to help them.